Hey guys, so I'm going to be showing you how to place a nasal cannula in this video. I always choose 2 nasal cannulas just in case one is too big or too small. So we have here a 10 French and an 8 French for a larger size dog. I always gather all the supplies I might need for my nasal cannulas. I just want to make sure that I'm prepared and I have everything I need before I start. The most important supplies are obviously going to be our nasal cannulas. We're going to use a local anesthetic like proparacaine or lidocaine, sutures, lube, needle drivers, and a few of the nasal cannula connectors. Right here I am setting up our humidifier, aka our bubbler. Basically the purpose of this is to keep the mucous membranes nice and moist because sometimes with the oxygen flow it tends to dry out the nose. You're going to want to use the oxygen connector, your oxygen line, and this bubbler right here. You can fill it all the way up to the max with sterile saline. The most important thing is having this ready, especially if you have an oxygen dependent patient. I want to make sure that this is ready so that when I'm done placing the nasal cannulas, I can immediately connect my patient. So a few indications for placing nasal cannulas would be respiratory distress, respiratory disease, hypoxemia, larger dogs, and no oxygen cage. This typically is not a sterile procedure, but I wanted to play safe because my patient was already febrile and had increased white blood cells. Concern for infectious pneumonia. So right here we are going to measure from either the medial canthus, from the tip of the nose to the medial canthus, or the tip of the nose to the lateral canthus or zygomatic arch. After I have measured, marked my spot, applied some lube, I am going to be applying also the topical anesthetic, so either proparacaine or lidocaine, just so that we can numb the area for patient comfort. So when you're placing the nasal cannula, you want to aim more medial and downwards. And then right after I place this, just to confirm placement, I did do an x-ray just so we can make sure we're good to go. So the trick to doing the finger trap is honestly experience. Do it over and over and over again until you get the hang of it. But basically you want to make your anchor, throw 2 surgeon's knots, and then you're going to go under, over, until you do about 8 or 9 throws. And then you always want to see a little bit of the bubble of the tube. That way you know that it's nice and tight. My patient is sedated so that it makes this whole process a lot smoother. She's nice and comfortable, nice and relaxed. Another way of confirmation would be to look at our SpO2. Once we connect the oxygen, we're going to see that SpO2 rise, and our goal is above 95% pulse ox. And so now she is pulse oxing at 100% with our oxygen. I am basically done here. I am just throwing 2 more sutures in with this butterfly tape. That way it's secure to her face. You can either do it on the lateral side or above her head. Really, it just depends on patient comfort.